a larger context to it. So that's something that is really, I think, unique about public health, and something that's really nice about being able to teach public health, is that it is a different way of looking at things, and it's really nice to be able to impart that or help students gain that perspective.
Yes, it is very nice. You know, I as everyone knows, this podcast is Clean and Comfort. It started just talking about the medical field and our cleaning processes. But as we evolved, we tend to meet so many different parts of the hospital, and so we interviewed nurses, we interviewed doctors, we interviewed people in the cleaning industry, and we said, let's branch this out a little bit more and talk about everything intertwined with the medical facilities that we work. And we decided to bring on Dr. Carr, who does public health, and other people who provided us with the cleaning products, and people who worked in the hotel industry, who are now working at the medical centers. And we try to figure out how all of these things relate. And the more and more I talk to people, I realize that all of us are one big bowl of different fruits that are trying to keep our customers healthy,
Right.
When it comes to, yes.
Yeah, I was just going to say, and so many occupations contribute to public health, even though it might not be something you think about every day. There are so many occupations where a person plays a role in the public's health.
Right.
I mean, it's really endless. Almost, I could probably argue, the majority of jobs even probably play a role in, society's health and well-being.
Right.
Yep.
So that's what my point was, and bringing you on and bringing Dr. Carr on, and Liz, for everyone, today's Saturday, and we scheduled this for Wednesday, and we scheduled it for Thursday. So we decided let's continue and finish this public health discussion so we can get back on our regular schedule. So thank you for joining us, and hope to see you on our, not the next podcast, but the one after, because the next one, you could join us on the next podcast if you like. But our next podcast will be discussing different features that we'll be starting in the housekeeping industry in healthcare, and how we're getting back to after COVID. So COVID now is dying down. And how is it for you guys in the education field?
Yeah, I think that we're still in a little bit of an unknown area, but hoping to go to gradually go back to normal. Not completely, but to start moving back towards normal offerings starting in the fall. So we're gonna ease back into more in-person, hopefully, over time. But I think it's going to be a slow process. So yeah, I think there's hope that we're going to be getting back to normal.
Hope. I like that word. Hope.
Soon.
I'm looking forward to it. I was listening to President Biden's address the other day, and he also hoped that by, what did he say? 4th, I think it was the 4th of July,
Hmm.
um, that, we could have small gatherings. That would be so
Small
nice.
gathering. That would be so nice. Yes.
That would be so
um,
nice. I am so
yeah.
looking forward to it.
Me
So,
too. Yeah.
so anything else in public health?
Um, no, I just like to say thanks for having me on 2 times. It was fun to talk about public health, and yeah, I just like I love to talk about public health, and like that everyone really, if you think about it, gets to play a part in public health in their own way, and it's kind of nice that you can think about even like recycling plays a part in public health, for
Hmm.
example. So like little things that we do, and for a lot of people, their whole career or job, especially if you're in the health industry, plays a role in public health. So it's nice that it's something that kind of touches all of us in a way.
But you're so right.
Yeah,
Recycling plays a
yeah,
part in public health.
yeah. No, we got to have a healthy environment. um, and yeah, we want even individual behaviors can help contribute to societal health. Um, we all can play a part and have a responsibility. So yeah.
Yes. I'm here wowed by the simplest thing is recycling. And we talk about the big thing, and I'm leading off topic, global warming, um, and how all of the little things like recycling that we were not paying attention to, and how it plays a big part in our public health. And it takes me
Yeah,
back to
yeah.
when New York, not even New York, London, when London did not have a good system of for sewage. They did not
Mhm.
have a good sewage system, and everyone was getting sick. Most people were getting sick and dying, and they had to
Mhm.
design a good sewage system just to get rid of body fluids and body waste and garbage from restaurants
Yeah.
and different things, and how that
Mhm.
played a big part in public health in London. So
Yeah. That that's really considered like the birth of public health was like the cholera outbreaks in
correct.
London. But yeah, so it's a really great point you brought up, and maybe something listeners would find interesting that um, it's considered one of the first epidemiologic like investigations in London when a lot of people were dying from cholera, and it was narrowed down to certain water pumps that were not sanitary. Um, and yeah, that's considered really the birth of public health. It's a really important historical event in
Yeah.
public health.
Yes. Thanks for the recycling little touch there.
Yeah.
So thanks everyone for joining Clean and Comfort. So that's our conclusion with public health. So we'll have Dr. Dahlia and Dr. Carr back with us. So thank you for joining Clean and Comfort on March 13th, 2021.